Upper extremities. Each shoulder consists of several bones: the clavicle, the scapula, and the proximal humerus. The clavicle, or collarbone, is located anteriorly. The scapula, or shoulder blade, is located posteriorly. The acromion process of the scapula is the highest portion of the shoulder. It forms the acromioclavicular joint with the clavicle and is a frequent area of shoulder injury. The upper arm and forearm consist of 3 bones connected at the elbow. The bone between the shoulder and the elbow is the humerus. The radius and ulna are the 2 bones between the elbow and the hand. Here and here. The radius is the lateral bone of the forearm. It is always aligned with the thumb. The radial pulse is taken over the radius. The ulna is the medial forearm bone. The wrist consists of several bones called carpals. The bones of the hand are the metacarpals. The finger bones, like the toes, are called phalanges. That's P-H-A-L-A-N-G-E-S. Phalanges. The PH is spelled F, is pronounced like an F. By this point in the chapter, you are realizing the importance of anatomical terms such as superior, inferior, medial, lateral, anterior, and posterior. These terms will be used throughout the text, and you will need to use them correctly to properly document and report your patient's injuries and complaints. So let's review these terms. So phalanges, clavicle, the collarbone, scapula, the shoulder blade, acromion process, the highest portion of the shoulder, acromioclavicular, acromioclavicular joint, where the joint where the acromion and the clavicle meet. Humerus, the bone of the upper arm between the shoulder and the elbow. Radius, the lateral bone of the forearm. Ulna, the medial bone of the forearm. Carpals, the wrist bones. Metacarpals, the hand bones. Joint, the point where 2 bones come together. That's in this next section. Joints. Joints are formed when bones connect to other bones. There are several types of joints, including ball and socket joints and hinge joints. The hip is an example of a ball and socket joint, in which the ball of the femur rotates in a round socket in the pelvis. The elbow is an example of a hinge joint, in which the angle between the humerus and ulna, which are connected by ligaments, bends and straightens, as the name suggests, like a hinge. Muscles. Like the skeleton, the muscles protect the body, give it shape, and allow for movement. There are 3 types of muscles. See figure 6.4. Voluntary muscles, involuntary muscles, and cardiac muscle. Voluntary muscle, or skeletal muscle, is under conscious control of the brain via the nervous system. Attached to the bones, the voluntary muscles form the major muscle mass of the body. They are responsible for movement. Voluntary muscle can contract upon voluntary command of the individual. For example, if you want to, you can reach out and pick up an item or walk away. These are examples of voluntary muscle use. Involuntary muscle, or smooth muscle, is found in the gastrointestinal system, in the lungs, blood vessels, and urinary system, and controls the flow of materials through these structures. Involuntary muscles respond automatically to orders from the brain. You do not have to consciously think about using them to breathe or digest food or perform other functions that occur under their control. In fact, we have no direct control over involuntary muscles. Involuntary muscles do respond to stimuli such as stretching, heat, and cold. So let's review. Voluntary muscle, muscle that can be consciously controlled. Involuntary muscle, muscle that responds automatically to brain signals but cannot be consciously controlled.